Hi, I'm Chris. I'm your nursing student. I'm going to be doing a full head-to-toe assessment on you. Can I have your name and date of birth?
My name is Laura Sorio. My date of birth is 6/28/93.
Okay, let me check your bracelet. Okay, so like I said, I'm going to be doing a full head-to-toe assessment, so you'll kind of hear me talking and just kind of verbalizing everything I'm doing. And just the general appearance, you look like you're in good health. Doesn't look like you're having trouble breathing. Do you have any chest pain or shortness of breath or anything like that?
Nope.
No, perfect. What's today's date?
Today's date is August 8th,
And
2018.
good. And who's the president?
Donald Trump.
Yeah. Okay. So starting at the head, and first I'm just gonna. Is it okay if I touch you?
Go ahead.
I'm just gonna look at your hair. Hair gets intact. It's not brittle. I'm just gonna move down to the rest of your face. It's symmetrical. No lesions. No redness or spotting. Can feel your ears. Any discomfort when I feel here?
Nope.
Okay. Perfect. Awesome. I'm gonna have you open your mouth and look inside. You have pink mucous membranes. Look like you're well hydrated. Your teeth are all intact, so it looks good. So next, I'm gonna check all your lymph nodes. So I'm just gonna kind of feel around your face, okay?
Okay.
And just kind of say what they are. So first, we have your preauricular, postauricular, occipital, your parotid, tonsillar, submandibular, submental, and then down the neck we have your anterior cervical, posterior cervical, and your supraclavicular nodes. And I didn't feel any hardness or anything like that, so they're good. Next I'm gonna do a quick eye exam. So we're gonna check to make sure your eyes are perla, so your pupils are equal, reactive to light. So first I'm gonna just look. My flashlight's going in a minute. Good. Good. And so I can look at my scale here that I printed out earlier. So your eyes went from about a 5 down to a 3 on both sides. And next I'm going to just check my reflex. So make sure the light is center in both. Okay, it's symmetrical. And then last I'm going to look at my finger and just follow it. Perfect. And so one more time, I'm going to check your cardinal gaze, feel the gaze. So I'm going to follow my finger, just with your eyes, so keep your head straight. Good. Okay. Now give me a big shrug. Perfect. Okay, so next I'm just going to move on to your arms. So just looking at them in general, there's no edema, no redness or spots. Looks good. I'm just going to check your capillary refill. It's brisk, less than 3 seconds. I'm just going to check both your radial pulses here. Good. They're both +2 and palpable. So next, actually, first, let me see your hands. Give me a squeeze. Squeeze my hands, and then pull me towards you, and then push away. Good. Okay, so now move on to a cardiac and respiratory assessment. So first, I'm just going to listen to your heart in a couple different places and just kind of say what they are, okay?
Okay.
And I'm using the diaphragm of my stethoscope first. Okay, so first we're going down to the second intercostal space on the right sternal border, and this is the aortic. Good. Then we move over the second intercostal space on the left sternal border. Our pulmonic, and so both of these, S2 is going to be greater than S1. Then we move down to our third intercostal space. This is Erb's point. Good. And we move down to our fourth. This is our tricuspid. Good. And then we move to the fifth intercostal space. But this is going to be midclavicular. And this is our apical pulse. So I'm also going to check your carotid here too. Good. So now I'm going to flip around to the bell of my stethoscope, a little twist, and I'll be listening for any murmurs, anything like that. So first I'm going to listen to your carotid. Good. Okay, I'm going to have you look to your left side. Okay, there's no distension, so that's good. So now I'm going to go back and listen to all these same spots for murmurs, okay? So starting again. on our second intercostal space, right sternal border. Good, and then on the left sternal border, second intercostal space. Good, I don't hear anything. Now move on to Erb's point, which is the space that you can hear the murmur easiest, and S2 is equal to S1, so equal. Good, and then we go into our fourth intercostal space, and this is S1 is going to be greater than S2. The tricuspid, and then last is our mitral. Good. Okay, so I'm going to flip my stethoscope back. I'm just going to feel your cardiac pulses again. Good. Good. Okay, so now I'm going to listen to your lungs, so I'm going to have you take a deep breath each time I move, okay? So deep breath. Good. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, so that's a 6 on the front. Then we'll do 2 on each side next. So deep breath. Okay. Deep breath. One more. Okay. One more. Deep breath. Okay, and then this one. Okay, I'm gonna have you stand up. So you're a little wheezy. Do you have asthma?
Yeah.
Well, that will do it. Okay, maybe just turn around. I'm going to listen to your back. So there's going to be 8 spots on the back. We're going to listen to. Deep breath. Good. Okay, so I'm going to have you lay down right here. I'm first going to listen to your stomach. I'm going to listen to each quadrant for a minute. Actually, you can just scooch over and like this. And listen for a minute each quadrant, unless I hear anything. Then we'll move on, so you're not sitting here for a million hours. Alright, can I lift your shirt up to your stomach?
Yeah. Okay.
Okay. So we're going to start in the lower right quadrant. Good. Lots of digesting. Good. 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 Okay. Now I'm just going to percuss real quick. Good. And I'm just going to feel. Any pain or tenderness here?
Nope.
Okay, good. So your abdomen is soft and non-distended, which is perfect. So next, using the bell of my stethoscope, I'm going to listen to the different arteries. So first, I'm going to go right below your xiphoid process. So we have your aorta, and we have renal. Good. Your iliac. And then last, femoral, down lower. Okay, and I didn't hear anything, so that's good. That's what we like. Okay, I'm gonna have you sit up. Actually, I'm gonna stand for a second. I just want to check your kidneys real quick. So I'm gonna have you turn that way. Any pain or discomfort when I do that?
No.
Okay, perfect. So then you sit down. So I'm gonna check your, actually sit on here. Just gonna check like reflexes. So just let your legs dangle down, okay? I'm gonna use my stethoscope. Awesome. Gotcha. Okay, so I'm looking at the legs. I don't see any edema, no redness, no bruising, no swelling. I'm just going to check your capillary refill on your toes. Good, it's brisk, less than 3 seconds. And I'm going to check both your pedal pulses. Good. It's going to be +2 and palpable. And these are also +2 and palpable. Okay. And that concludes the head-to-toe assessment. Seemed like you're in pretty good health, so thank you.